Can I see the, yeah, good, fantastic. So I remind you, we're not ready yet for the massage, yes? We have to change the towel, yeah? Are we ready yet? No, you have to do the other towel. Who've had massage before that they felt cold and it was quite unpleasant, yeah? Good. So the two towel technique, do you all use it?
Yes.
Yeah, good. It's really good. One of the feedback from the examiners was that it looks fantastic. I mean, you know, 7 students, all great towel technique. So keep it there. Right. So hold. Yeah. I will run that kind of technique a bit quicker because we want to go into the deep tissue quicker. Yeah. Hold. Relaxing yourself. Yeah. Taking the towel down. Can I undo the bra? Yeah. It's done already. Good.
She's keen.
Yes. Good. Yeah. So, starting with the effleurage. Yeah. In the exam on Friday, quite good, nice slow effleurage. Start really slow. Relax. It's also help you to relax. Yeah. You don't have to rush into it. And sometimes in counterintuitive, when you're stressed, you need to relax the most. So it really helps. Diamond effleurage, one hand effleurage. You know, start stretching yourself. Enjoy it because nobody else would. You know, nobody else would do that. So really, I feel that I stretch now my back, my shoulder. Very, very nurturing for both. That's how it should be. If you're suffering from that, if you're doing it not right, they will feel also. So, what's next after? Exercise. Good. So, coming, and then you start working deeper. Yeah, but not too deep. You can't jump too quickly. You have to warm up the muscles. Yeah. So look at the body position. You know. Quite active. How's the pressure? Good. Which type of petrissage that one? Ringing. Good. Good. So I now do more like the base of the wrist. Yeah. So I change my body position now. It would need to respond to the technique that I do. Yeah? Okay. Let's say now I find an area that is tensed. Yeah? So I can do compression. Remember how Earl showed last time to do that? But let's say compression is very thumb abused technique. The thumb is quite small joint, and if you use it a lot, then you can injure, hurt yourself. So we want to work on a broader surface, but quite safe for us. And also, you know, some people, you can work hours on your thumbs, and it, you know, doesn't do a lot of difference. You need something a bit more strong. Okay, so good, a few more effleurages, and then you decide, okay, I'm ready. So the first question students ask is, which elbow to do it, which forearm to do? Well, good thing is that we create it only with 2. So try it and see. If you like it this way, do it. And ask your body, what's going on there? Am I comfortable? Because I'm not going to be there to tell you. So I would use this one. I'd use the right forearm, or I can use the left one. Some people would feel more comfortable with one or the other. So it's no right and wrong. It's more how do you do it, the quality of your work. Okay, so you start it. You remember the rectus spinae muscle? Mm-hmm. Yeah, where's our man here? Yeah? Now, the rectus spinae muscle is quite narrow. Mm-hmm. So it's very close to the spine. So you can't go here. These are the ribs. So you have to be quite closer to the spine, but yet not on the spine. Yeah? So you're slowly preparing it. You can't go, oh, I'm here. I'm the therapist. I have the qualification. I'll tell you how to do it. No. Start slow. Organize yourself. You might need to change your position a little bit. Find it. Find where it is. And then slowly sink in. Remember, like the submarine, you're sinking in slow. You can't go too deep. Because if it's too deep, where is Teresa? Ah, exactly. Pain, yeah? Remember the therapist that did it too quickly? Okay. So now you find a place and then you slowly sink in. Okay, only now I'm ready slowly to move. And the movement is actually almost non-seen. It's very slow. It's almost like her body rest and allow it to move slowly. Now it starts moving faster, a little bit faster.
And the breathing could help that as well.
Absolutely.
Wouldn't it? 'Cause it will move it.
Yeah. Good. Now, it moves a bit too further away from me.
You need to move.
I need to move. Thank you, Claire. I need to move. And I'll tell you how I move. If I'm positioning myself this way, I don't start to move like an elephant. All I do is just heel, toes. Yeah? That's it. And then you're there. And then you can continue. When that moves too further, again, heel, toes, and then continue. So, because if you are deep there, if you start moving, every movement can actually undo the balance.
So you basically don't move the position of your
No,
arms.
I don't. I can go and do a little bit there, and then lift it, and then move. But you could actually keep it on the same position. Good. After a little bit of deep work, effleurage, yeah? Let them rest. You do bits. Let them rest. Do you see how red it is? Yeah. How good the blood circulation improved there, yeah?
The deep tissue is not only with your forearm, though.
No,
Okay.
no. Also with your knuckles, and so we'll continue. Okay. Now, before I let you start working, one issue that is very, very important. Yeah? Where actually to put your body. I'll give you 3 positions, and you tell me what you think is best. The first position is that your body is backward to the elbow, and then you move.
That's gonna hurt.
The second position is that your body is exactly on top of the elbow. The third position is your body is forward. Why not?
Strain.
You strain your back shoulder. Ooh, you go against the odds. So you need to find where to put it. If you're putting it too forward, you're going to glide. Yeah? If you're going to be right on top of it, you can't move. So I would suggest to start with finding how you can be right on top of it, and then slowly move a little bit backward, so then you move forward. Do you see it? Again, I'll do it again. You're here, you go a little bit backward, and because now the pressure goes this way, the oil allows you to move that way. Try it, okay? So you can do it this way. You can come and do it from the upper part. Yeah. Try not to fist so much. Try to relax your hands. How's the pressure? Change a little bit. Change. Good. You know what the image I have? Do you remember this when they lay the asphalt on the road? There is this machine that moves slow
Yeah.
and press everything. Yeah. So I want you to do it in that way, deep and slow, and then everything is smooth and soft at the end, yeah? Don't do it bumpy. Every time you move, it's quite bumpy. So it's a lot of self-control also, you know? That's why you don't do it at the beginning. You need to have the body awareness to do it gentle, to control yourself before you start, you know, use the heavy cannons.
Is that,
Okay?
is
Yeah.
that the only place on the back where you can do it? Just
No,
there?
you can do it on the QL, on the quadratus lumbarum. Yeah, you can do that. After that, I'll show you other technique that you can do on the shoulders. Yeah, quite nice in here. Yeah.
But this is supposed to be quicker.
No, no, a little bit slower. I do it a bit superficial. So, yeah. Actually, you know what? I can do the effleurage this way. The rules are you to understand the differences, then you can play with them. You don't have to stay. It's boring otherwise. Yeah, you can do effleurage. I have some big, you know, maybe sporty people that comes. If I'll do effleurage, they say, "What are you doing? Come on, get into it." You know. So you're thinking, "Okay, effleurage. How are you, John?" And start working quite deep. Yeah, that's the effleurage I give them. Yeah. So then a lot of different techniques, yeah, a lot of forearm in a different way. After that, we might do elbow, but that's actually the more deeper. But any other question before you start practicing? Okay, so let's close down. Deep tissue and deep tissue approach. Who would you like to? Who do you think need deep tissue?
People who bodybuild, like people who use their muscles a lot.
Yeah, so people who use quite stiff muscles, yes.
Stressed people?
Sorry?
Stressed people?
Stress people?
Sports.
Sports people?
Most people. just
Most people.
In whatever
Yes.
area they're going to be
Yeah.
using different muscles.
Yeah, correct. Yeah, so most people do need to have some deep tissue, but some people don't know it and they say, "Oh, I don't like it deep," because they've had a bad experience with. However, some people are very, very sensitive. So some people, although they look quite big, it doesn't mean that they actually can take the work. So it's very subjective. And it's not about body type, it's about really how much they can take and how much they enjoy. And if you see them clenching their fist and their toes, it's not good. It's counterproductive. Yeah, okay. So do you think anything you can do before you actually starting the massage with deep tissue?
Just feel where it's tense.
Yeah, good. Can you do more technique?
Warm it up properly.
You can warm it
The
up properly?
effleurage and petrissage.
Or how
technique.
about that?
Oh, okay.
For hold.
Sorry?
For a hold.
For a hold. Oh, well, maybe nice to start with a hold, but on top of the tower.
How much pressure do you put?
How much pressure do I put?
Do you put like
Lindsay? Thumb. So I actually put my weight there.
And what is doing for client? They're just relaxing? Or?
Yeah. You don't use it a lot, but I'm just thinking, okay, well, give it a try and see. Can I undo the bra? So then starting with the effleurage.
no.
Yeah, warming it nicely. Petrissage. Finger kneading. And then you slowly get to feel what's underneath, yes? Okay? So, few things about what I've seen. First about your position, come quite closely. Yeah? Come quite closely into the back leg is always a bit more straighter. Yeah, a little bit more straighter and you can bend it then. slowly sink in, but don't try to move it. Let your body position allows the movement to happen. So what do I mean? Try to move it is that. Allow it to move by itself is that. It moves by itself, yeah. I don't do anything. It's just gliding by itself. It's like ski, you know. If you put yourself in the right position, right angle, you just glide. If you go uphill, quite hard. Okay, few variations, okay. So let's start with the lower back. Lower back, you do nice effleurage and pétrissage, and then you can start actually with the lower back, but be careful not to push too downward. You don't want to increase the, remember how do we call this curve? Lordosis. Good. You don't want to start to increase the lordosis, so you need to actually work more on the upper gluteal area. Yeah. So you work on the upper gluteal area, a bit of the QL, quadratus lumbarum, yeah? Okay. Another middle back. Instead of doing the pétrissage this way, I use the forearms. Now it's quite tricky. Why? Every time you have to put the body in a different position. To move left, you need to move your body to the right and then glide. Then to move that way, you have to move this way. Again, I want to move that way. Now I want to move that way. I have to keep going the opposite way and then move. Yep. Same here. You just change your position. Which muscle do I work now? Erectospinae, trapezius, rhomboids. Yeah, good. A little bit maybe infraspinatus on the side. Yeah. Okay. One more here on the upper trapezius. You have to kneel, but still keep your hip moving forward. Now, between that position and this position, it's big difference. Here, I can push it. Here, I've lost it. So be aware to push really where you can do. Now,
I feel like sometimes maybe your elbow goes in.
No. Does it go in? No. The elbow is there. The pressure is here. Yeah. Now be careful because don't start doing it on the neck. Neck is quite sensitive. It's small, isn't it? It doesn't need that elbow, but upper trapezius do need it really. Good. You can do that this way, yeah, and just keep it like a nice stretch. But be careful because now you've lost it. Okay. Let's try the other side.
Which feels nicer, Lindsay?
Well,
Forget it.
So we went through the whole spine, yeah, really from the neck, shoulder, all the way into here. You can then maybe if you want to try a little bit, you can do more advanced technique of taking both of them, you know, and lifting them. Yeah. So one hand on the upper trapezius, the other hand is just below the scapula. And I want to show you one more thing. Can I have another towel, please? Yeah. If you take another towel and you roll it and you put it underneath, yeah. So then look what happened to the shoulder. You see that all the tight muscle in here are a lot softer. So you can do it now. It might be a little bit too high, so you need to, you know, make it a bit more flatter. Lift your shoulder, please. Thank you. Okay. Good. How does it feel? Comfortable? Yeah?
Yeah.
So then you can do the same thing. But it's correct not only with elbows, with the forearms, for every technique. You can use the bolstering on the shoulder in that way. Yeah? Now, how to use... Actually, let's finish now. I want to do it in more easier chunks. So I want to actually see you because I didn't see you much. Let's do it again. And try now moving from the static into more dynamic, yeah? And if I will have, for example, a client that really needs deep work, then I can really take it slow. And then another one. What do you think are the relationship between speed and depth?
The slower, the deeper.
The slower, the deeper. Yeah. So if you want to go deep, you have to go slow. Otherwise, they really wouldn't like it. Yeah. Really slow. Remember this machine that lay the asphalt is really slow, but very intense. Okay. So be responsible there. Any question? Let's start then.